Hi, I'm Lakshi Aldredge, dermatology nurse practitioner from Portland, Oregon, and I am so excited to have been invited to SDNP 2026 here in beautiful Phoenix, Arizona. I was so honored to be able to deliver the Skin of Color lecture and cultural considerations. This is such an important topic, especially in this day and age in the U.S., where the majority of the U.S. population by 2040 is going to be skin of color patients. And how do we in dermatology address their unique skincare needs? So in my session, I talked a lot about the unmet need and the growing number of skin of color patients. I also covered in a case-based presentation the ability to recognize common skin conditions such as psoriasis, atopic dermatitis, even melasma in patients with skin of color, because sometimes the presentations are different than in lighter skin toned patients. We also talked about novel therapies that are coming out that are actually showing incredible benefit in repigmentation of patients who suffer from hypopigmentation after they have experienced a skin condition that depigments their skin. So that is an amazing new opportunity for us as dermatology NPs, PAs, and other clinicians to focus on a really important quality of life issue for these patients. And then finally, we covered cultural considerations. You know, oftentimes we in dermatology have 5 minutes with patients. We go in, we start looking at their skin, we take off their clothes, and for some patients, they're not comfortable with that. So really thinking about the patient sitting in front of us, taking the time to sit down, ask permission about how they would like their examination to go. Are they comfortable with removing their clothing or having me look at their skin? Perhaps they want to have a family member also present or somebody else from the office. We also talked about different cultural practices that may influence their skin health. So it was such an honor to be invited. Consider looking out in the literature and then getting yourself more informed about this unique group of patients.